Hello everyone, and welcome back to WUT News, your trusted source for informative, educational, and awareness-driven content. Today, we are diving deep into a very important and sensitive health topic that affects millions of people around the world: Actinomyces genital infection and HIV/AIDS. These are not just medical terms. They represent real-life challenges faced by individuals, families, and communities globally. Many people still lack proper knowledge about these infections, how they spread, how they can be prevented, and how they can be treated. This lack of awareness often leads to fear, stigma, and serious health consequences. In this video, we will explore everything you need to know in a clear and simple way: the history of HIV/AIDS and actinomyces infections, how these diseases spread, symptoms and complications, countries most affected, prevention methods, protection strategies, and important facts everyone should know. So make sure you watch this video until the end, because this information could save lives. Section 1. What is Actinomyces genital infection? Actinomyces genital infection is a rare but significant bacterial infection caused by a group of bacteria known as Actinomyces. These bacteria normally live harmlessly in the human body, especially in the mouth, digestive tract, and female reproductive tract. However, under certain conditions, they can cause infection. In the genital area, this infection is often associated with poor hygiene, long-term use of intrauterine devices, IUDs, weakened immune systems, tissue injury, or trauma. This infection can lead to chronic inflammation, abscess formation, and tissue damage. Although not as widely known as other sexually transmitted infections, actinomyces infections can become serious if left untreated. Section 2. What is HIV/AIDS? HIV stands for Human Immunodeficiency Virus. It attacks the immune system, specifically the CD4 cells, which help the body fight infections. If untreated, HIV can progress to AIDS, acquired immunodeficiency syndrome, the most advanced stage of the infection. At this stage, the immune system is severely damaged. The body becomes vulnerable to opportunistic infections, and even minor illnesses can become life-threatening. Section 3. History of HIV/AIDS. HIV/AIDS was first recognized in the early 1980s. The initial cases were reported in the United States, where doctors noticed unusual infections among young men. Later research showed that HIV likely originated from a virus found in chimpanzees in Central Africa. It crossed into humans through blood contact, possibly during hunting. By the late 20th century, HIV had spread worldwide. Millions of people were infected. Since then, medical science has made major progress. Antiretroviral therapy, ART, allows people with HIV to live long, healthy lives. However, HIV remains a global health challenge. Section 4. How these diseases spread. HIV transmission. HIV spreads through specific bodily fluids: blood, semen, vaginal fluids, breast milk. Common ways HIV spreads: unprotected sexual contact, sharing needles, blood transfusions, unsafe, mother-to-child transmission. Actinomyces infection spread. Unlike HIV, actinomyces is not typically classified as a sexually transmitted infection. However, it can spread through direct contact with infected tissue or internal growth when bacteria enter deeper tissues. Risk factors include poor genital hygiene, long-term IUD usage, and weakened immune systems. Section 5. Symptoms. HIV symptoms. Early stage: fever, fatigue, swollen lymph nodes. Later stages: weight loss, chronic diarrhea, night sweats, severe infections. Actinomyces genital infection symptoms: pelvic pain, abnormal discharge, fever, abscesses, tissue swelling. These symptoms may develop slowly and can be mistaken for other conditions. Section 6. Countries most affected. HIV/AIDS is a global issue, but some regions are more affected. Sub-Saharan Africa has the highest number of HIV cases. Countries like South Africa, Nigeria, and Kenya have large affected populations. Asia and Latin America also report significant numbers. Actinomyces infections are less documented globally, but occur worldwide, especially where healthcare access is limited, hygiene awareness is low. Section 7. Prevention methods. Preventing these infections is possible with proper knowledge and behavior. HIV prevention: use condoms during sexual activity, avoid sharing needles, get regular HIV testing, use pre-exposure prophylaxis, PrEP, if at risk, ensure safe blood transfusions. Actinomyces prevention: maintain good hygiene, regular medical checkups, proper use and monitoring of IUDs, early treatment of infections. Section 8. Protection strategies. Protection isn't just about avoiding infection, it's about building a healthy lifestyle. Key strategies: educate yourself and others, practice safe relationships, seek medical advice when symptoms appear, and avoid stigma and discrimination. People living with HIV deserve respect, support, and equal rights. Section 9. Treatment options. HIV treatment. There is no complete cure yet, but antiretroviral therapy, ART, controls the virus, reduces viral load, prevents transmission. Actinomyces treatment. Long-term antibiotics, sometimes surgery for abscess removal. Early diagnosis is crucial for both conditions. Section 10. Important facts you should know. HIV does not spread through casual contact like hugging or sharing food. People with HIV can live normal lives with treatment. Awareness reduces fear and stigma, and early testing saves lives. Conclusion. Understanding diseases like Actinomyces genital infection and HIV/AIDS is not just about medical knowledge, it's about protecting yourself, your loved ones, and your community. Education is power. Awareness is protection. If you found this video helpful, informative, and meaningful, don't forget to support our mission. Deep, Dark, subscribe to WUT News now. Turn on the notification bell and share this video with your friends and family, because one share could save a life. Thank you for watching, and we'll see you in the next video.